Hello friends, I am Dr. Dhrumin Sangoi, consultant orthopedic foot and ankle surgeon practicing in Mumbai and attached to Apollo Spectra hospitals, Tardev and Chembur in Mumbai. So I'll be talking about common foot and ankle problems which affect us in our day-to-day life, and some of them will be ankle sprain, flat foot, heel pain, arthritis in the feet and ankle, bunions, which is also called as hallux valgus, and finally about some diabetic feet and diabetic ulcers and Charcot feet. Okay, so let's talk about ankle sprains first. Ankle sprain, yani takne mein moch ana, is very commonly seen in our parts of the world where we have irregular roads and potholes, especially more so in the rainy season. इसमें होता क्या है, तुम्हारा ankle it twists downwards and inwards and you injure your ligament on the outer side of the ankle. यानी आपका ligament जो है बाहर की side उसमें injury आ जाता है. And once this happens, you get pain and swelling in the outer side of the ankle, which is the most common type of ankle sprain. There are some ankle sprains which are more severe and it may involve the ligaments on the inside of the ankle, and sometimes the injuries can be higher up above the ankle joint, which is called as high ankle sprain. And sometimes the injury and the twist can be so severe that you can have an associated fracture which needs to be ruled out with an X-ray. Now, how do we manage these simple ankle sprains? So the most common management is with conservative measures and including rest, ice packs, compression in the form of a crib bandage or an ankle brace, and painkillers and anti-inflammatories which are needed in the initial period. If the sprain is very severe, then ankle brace and bandage might not suffice and you may need a walker boot or a plaster for few days. So 80 to 90% of these ankle sprains will heal on by itself. Only some, like 10 to 15%, might cause problems for you in future. So after the ankle sprain heals in the initial period, you need proper physiotherapy and rehabilitation to get back on your feet and get back to your sports activities. But if this ankle is causing recurrent instability and is turning inwards again and again like this, and you feel the instability while you are walking or running, then that needs further evaluation with an MRI scan and to see if the injured ligament has not healed properly. और अगर ऐसा होता है, then you might have to consult a foot and ankle specialist, and a surgical option may be considered if your all conservative measures and physiotherapy have failed. The surgery for ankle sprain is pretty simple, which involves making a cut on the outside of the ankle and repairing your ligament and tying it back onto the bone. And sometimes if the instability is severe, you may need additional reinforcement with a tape which we put on addition to your repair. And after that, you'll be in a plaster for just 1 to 2 weeks, and then we mobilize you with the help of a brace, and then you get back onto your sports and other activities gradually. The next topic is on flat foot. Flat foot is very commonly seen in different age groups, and the causes in different age groups vary. Flat foot is also known as सपाट पैर, यानी फुट का आर्च सपाट हो जाना and it touches the ground. इसके साथ और क्या होता है is your heel bone is shifted outwards and it no longer lies in line with the leg bone, and there is an abnormal biomechanical force transmitted from the ground onto your legs, which if not treated may lead to arthritis. So बच्चों में फ्लैट फुट होना is normal and the arch develops as the child grows. लेकिन we need to rule out certain pathological यानी abnormal causes in them with X-rays. And as the child grows, the arch will develop by around 10 years of age. If the flat foot persists after that, then again you need to evaluate them and get X-rays done to rule out abnormal fusion of bones in the feet, which can cause this flat foot deformity. Flat foot, if it develops later in life in adults after say age of 20, it is usually due to a muscle which stops working in your ankle, which is called as the tibialis posterior muscle and tendon, which comes on this side and attaches onto the bone here. So if it is not working, your arch will flatten. And along with that, your heel bone is shifted out. And if this continues in life in older people, because of the abnormal biomechanics, you develop arthritis in the feet. अब इसे ठीक कैसे करें? So in children, we usually do not recommend any insoles or braces, and we wait and monitor them serially and follow them up every year to make sure that they are developing arch. They should continue to do their daily running activities and sports without any restrictions if they do not have any pain. In adolescents, यानी 10 to 18 years के age group में अगर flat foot है, then again if there is no pain, तो कुछ करने की ज़रूरत नहीं है. But if they are developing pain, then insoles will help them and physiotherapy or stretching exercises will help them. And if the physiotherapy fails and the pain continues, then X-rays, MRI scan and further evaluation can be done and surgical treatment can be offered to them. Next comes the adulthood phase, and isme the muscle which I told you which is not functioning, we need to strengthen that muscle, and physiotherapy again is the mainstay for this. Along with this, insoles are a must if the flat foot develops in adult life. This is to realign your heel bone in line with your leg bone to correct the altered biomechanics of the feet. और अगर इससे आपके symptoms ठीक हो रहे हैं, then you need to continue doing the exercises and continue wearing the insoles. But if the pain is persisting and your heel continues to be outside, then you may need surgical intervention to realign the heel bone back to its normal position and repair the tendon which is not functioning.
Rolling.
And finally, in adults who come with flat feet, even their life is miserable because the new adult
Rolling.
And in adults, if the flat foot is causing problem, it may be due to arthritis and it needs to be treated because the definition of old age is changing and the older people are now becoming younger and younger and walking more. So in those people, if there is a flat foot with arthritis, then the treatment options are fusion of the bones, where we fuse the bones and again realign them so that the heel bone lies under the leg bone and you walk with normal biomechanics. So the third problem which we'll talk about today is heel pain. Heel pain is very commonly seen and affects many people around the part of India. And there are two main types of heel pain. One is the inferior heel pain, which we also call as plantar fasciitis, यानी कि पाँव की एड़ी के टिश्यूज में सूजन आ जाना. And the other type is posterior heel pain, जो कि इधर होता है, and which is more commonly due to your Achilles tendon problem. तुम्हारा जो काफ मसल है लेग के पीछे, वो ऊपर से आके Achilles tendon बन जाता है, which is a type of muscle and attaches onto this heel bone, और उधर सूजन आ जाता है. So these are the most two common types of heel pain. अभी जो inferior heel pain है, which is more common than Achilles pain, is due to prolonged standing, wearing hard chappals or slippers, and walking long distances. What happens in that is that the calf muscles are tight, and because of that tightness, and the calf muscles are connected onto your heel bone and the plantar fascia as one continuous structure, and because of this tightness, the plantar fascia becomes inflamed and that causes the heel pain. ये ज़्यादा करके मॉर्निंग में पेन होता है. The pain subsides gradually, but again comes back when you start walking long distances. The mainstay of treatment for plantar fasciitis is stretching, stretching, and stretching. Surgery is very, very rarely performed, almost negligible, and most of the patients, 99% of them, will improve with stretching exercises. If the stretching exercises don't work, we have other alternatives like PRP injections, which is platelet-rich plasma, which we produce by drawing your own blood and centrifuging it in a machine and that is injected onto your plantar fascia. Studies have shown that that does help in healing of your plantar fascia. But along with that, stretching is a must. The other type of heel pain is Achilles tendinitis, where your Achilles tendon attaches onto the heel bone. That pain again responds to stretching exercises because the mechanism of and the pathology is the same in both these cases. And if the exercises are not helping with the Achilles pain, then surgery can be helpful by excising the extra growth of bone at the back of the heel and reattaching the tendon onto a good healthy bone. Again, depending on each case, this can be performed with minimally invasive surgery where we insert a camera, or also called as an arthroscope, into the back of your heel and shave off the extra growth of bone at the back of your heel. So remember, all heel pains can be managed with exercises and physiotherapy and wearing proper footwear. And if your pain persists, do consult a foot and ankle specialist to explore further options and get a pain-free heel. So the next topic which we'll speak about is arthritis in the foot and ankle. अब arthritis दो प्रकार के होते हैं, osteoarthritis यानी wear and tear due to age and rheumatoid arthritis जिसको वाह भी बोलते हैं. उसका मतलब है कि ब्लड में ऑटो इम्यून एंटीबॉडीज जनरेट होते हैं जो तुम्हारे जॉइंट के कार्टिलेज को अफेक्ट करते हैं, और ये हर जॉइंट्स को अफेक्ट करते हैं स्टार्टिंग फ्रॉम योर नी, शोल्डर, हैंड्स, फिंगर्स एंड ऑल्सो योर फीट एंड एंकल. इसे टखने और पैर में गठिया आ जाना भी कहते हैं, विच इज सेम एज डेवलपिंग आर्थराइटिस. अभी इसमें होता क्या है दैट as you start walking more and more, the pain starts to increase because the cartilage between your ankle or your foot bones start to wear out. Now there are 26 bones in your feet and each bone articulates with the other bone and between them lies the cartilage. If that cartilage is damaged with each walking episode or each movement of the foot, those bones start rubbing and you get pain. Rheumatoid arthritis यानी वाह का problem can be managed with medications and it is good to consult a rheumatologist for the same. However, in osteoarthritis, which is due to wear and tear of the joints in your foot, if the medications are not helping you, then steroid injections can be tried. Now, these steroid injections are pretty safe because they lie in the joints and they are not absorbed into your blood and systemic body circulation, and hence the side effects are lowered. Again, as mentioned before, the arthritis can also develop because your foot shape is not normal, as in you have got a flat foot where the heel is going out, or you have got a high arch foot where the heel is going in, and this causes abnormal loading of the foot each time you step and walk, and this causes arthritis as you age. If the conservative measures fail, then surgery is an option, and in that we fuse the joints in the foot whichever is affected by it. So if you are suffering from arthritis in your ankle which causes pain right there in front of the ankle, then ankle replacement, just like a knee and hip replacement, is now an option and available in India. So our next topic is called as bunions यानी पाँव के अंगूठा टेढ़ा हो जाना. It is also called as hallux valgus in medical terminology. So basically what happens is the big toe, instead of pointing straight, it starts bending this way. And that causes a problem with your other toes. It causes a problem in wearing shoe wear and it causes pain. Now this happens because your muscles and tendons on the inside are not functioning as they should. As in the muscle which is present here starts pulling the toe outwards, and this causes a prominence on the inside of the toe. This is the part which is the painful part and which rubs against your shoes. अब इसे ठीक कैसे करें? So there are splints available which temporarily straighten your toes, but these only work when you wear them. They will not reverse the deformity. This problem affects your gait because the third cycle of the gait, which is which is the toe off. So the heel strike, flat foot, and toe off. The toe off is affected because your big toe is bending outwards. So the only option to correct this, if it is causing pain and is affecting your day-to-day activities, is to surgically realign the big toe and bring it in line with the other toes, which is straight. And that can be done with an osteotomy, यानी bone को cut करके realign करके fix करना with screws. This is also a relatively straightforward surgery which is usually done as a day case procedure, and you are walking on the same day, and the stitches come out at 2 weeks, and the recovery takes around 4 to 6 weeks. Now, along with bunion, some people have clawing of the lesser toes, यानी दूसरी छोटी उंगली claw हो जाती है, and these causes pressure on the footwear and causes pain on the top of the toes. Again, if these are not managed conservatively and still cause pain, they can be straightened up and realigned. And another common problem associated with this part of the foot is called as metatarsalgia, यानी पाँव के इस portion में pain होना. And this is commonly seen in people who wear narrow footwear and high heel shoes, which are narrow in front and they put more pressure on the front part. The solution for this is to wear shoes with a wider toe box, and sometimes insoles can help in the metatarsalgia pain. And the next topic for today is diabetic ulcers and Charcot foot, यानी मधुमेह संबंधी अल्सर्स होना फुट में और हड्डियों का नरम होना, और that can develop deformities in the foot. So India is the leading capital for diabetes now, and diabetic neuropathy affects the foot very commonly. इसमें होता क्या है कि पाँव की जो छोटी नस है वो काम करना बंद कर देती है because of high sugar since many years, and this causes lack of sensations in your feet, यानी पाँव में टच और छूने का महसूस नहीं होता है, and इससे अल्सर्स होने के चांसेस बढ़ जाते हैं. So it is very important that all diabetics should have proper care of their feet. They should get evaluated routinely with a podiatrist या your diabetologist, and to see a foot specialist as well. So diabetic ulcers are very common, and the most important aspect to understand them is prevention. Prevention is the key. So care of your feet, avoid going in hot sun and stepping on hot surfaces, avoid going barefoot outside, and making sure that you do not injure your foot with any stone or a thorn, because the healing takes longer time in diabetics and can develop into an ulcer. However, if you are unfortunate and the ulcer has developed, early intervention and early seeking of help is the most important, and you should see a foot specialist for this. Regular dressings of your diabetic ulcers, taking antibiotics when it is infected, and correcting the deformities which is causing the ulcer is most important. There are many foot deformities which develop in diabetics, like the big toe pointing down and causing pressure underneath and causing an ulcer. So just managing the ulcer will not help you. You need to correct the deformity and realign the bones so that the deforming force or the causative factor is eliminated. And another important aspect of diabetic feet is also called as Charcot foot, where the bones of your foot become soft and brittle and they dissolve. यानी हड्डी इतनी नरम हो जाती है, which is because the nerves and the vessels going in your feet are compromised because of diabetes. और इससे पाँव में deformities आने चालू हो जाते हैं, and they cause pressure on the skin, and that is a risk for ulceration. So with this, you will get diffuse swelling in the foot, there will be redness in the foot, and if you develop these symptoms, it is important that you see either your diabetologist or a foot specialist. Once you get these, we need to get X-rays and MRI scans to evaluate and diagnose it early, and early intervention will help you. The treatment for this is in the form of casting, which we also call as total contact cast, and in severe cases, if you are getting an ulcer or an impending ulcer, then surgery to realign the deformity and your bones, and fusion with the help of a super construct or big plates and screws will help restructure your foot into a normal shape and prevent the ulceration. So next we'll turn our attention to frequently asked questions by people to me in my clinic. Number 1, Dr. Saab, foot and ankle surgery karna safe hai ya nahi? This is a question troubled by many because foot and ankle is a super specialized field in orthopedics and not many people perform. However, we as fellowship trained foot and ankle surgeons are experienced in doing them, and yes, foot and ankle surgeries are safe. Even flat foot correction surgeries or hallux valgus or bunion surgeries, they can be corrected and you can lead a better quality of life after correcting those. Next question is, how long will I be out of action after a foot and ankle surgery? Yes, so any surgery in the feet and ankle mostly is followed up with a period of plaster for around 2 to 6 weeks. Now this varies depending on the procedure performed. If it is a toes and lesser toes and a forefoot procedure, it's usually much earlier and you are walking within 1 to 2 weeks. However, it is a big bone surgery where we are fusing our bones or correcting your flat feet, then it needs a plaster for 6 weeks and then you start walking. Next, people with flat foot often ask me, should I wear insoles? And the answer is absolutely yes. You need to wear insoles so that your heel is realigned in line with your leg as much as possible. It will not correct your deformity completely, but whatever extent it corrects is beneficial for you, as that will help to prevent future arthritis. Next important question asked by, Doctor, I have suffered from an ankle sprain and an MRI is showing a ligament tear in my ankle. Do I need to be operated? Answer is no, if it is a simple ankle sprain. So just a low ankle sprain can be managed conservatively to begin with, and acute ankle sprains do not need surgery. If they are causing instability in future and after a phase of exercises and physiotherapy, only then it needs to be managed with ankle reconstruction and repair of the torn ligament. Only in certain instances where the ligaments all around the ankle are injured or particularly high ankle sprain, we advocate early surgery to get back to your feet and routine activities earlier. Many people with flat foot come with other joint pains like the knee pain, and they also complain that their spine and back is hurting. This is possible because with your flat feet, the heel bone is shifted out and that causes an abnormal loading from the ground up to your body. So the line of action and the line of force passes from the heel, which is outside. It goes on the inside of the knee rather than going through the center of the knee. So that causes the medial knee pain, and that's why many people with flat feet complain of knee pain. And this abnormal force also travels up and affects your hip joint and your spine, causing back pain and issues like that. And hence insoles are a must if the flat feet are causing you all this pain, and in severe cases surgical realignment is necessary. So this is an overall picture of the foot and ankle problems in orthopedics which affect us in common day-to-day life. I hope I have answered all your queries, and if you have any foot and ankle related issues or problems and would like to consult me, I am available at Apollo Spectra Hospital at Tardev for consultation. Thank you.